We're uncovering the hidden body clues for everybody, even the littlest ones. And Jennifer has this question about her bundles of joy.
Hi, doctors. I just gave birth to twins. This is Zachary and this is Kira. And I'm very excited, but a little overwhelmed at the thought of bringing home two newborns at the same time. I just have a couple questions for you. What do you need to watch for with jaundice? And Dr. Sears, is there anything else I should be looking for with twins in the first couple weeks?
Wow, they are so cute, aren't they? And as an OB/GYN, it is such an honor to be the first one to hold and look at the baby. And actually, when we first look at the baby, as an OB, we kind of look at they assess the baby really quickly to make sure it's breathing and the color. And these are all sort of reflected in a system that we developed called the APGAR system. And this looks at appearance, and it looks at the pulse, the grimace, basically the baby's, facial expressions, activity, respiration. These things are rated basically on a scale of 0 to 2, 10 being the greatest. Only pediatrician kids get 10. Otherwise, anything over 8 is really good. But what it does for us as obstetricians is it lets us know if there was a hypoxic event before delivery, either due to a cord around the baby's neck, a placenta, prolonged contraction, to let us know how much of an insult to the baby to say to the pediatrician or the respiratory therapist if they're going to need some, some assistance in breathing, if they're limp or aren't breathing.
And it's interesting that the APGAR score, the word APGAR, actually, it's an acronym, but it's also the last name of the doctor who came up with this, Virginia Apgar. She was an anesthesiologist that was grading, new infant activity. But, and it helps us. Suppose I run into the room after the baby's been delivered, and you can just yell at me, APGAR 3, and I know, okay, that baby is blue, not breathing, and doesn't have much of a heart rate. Instead of telling me all that stuff, I can just go, okay, baby's in trouble. And whereas if you say APGAR 8, I'm like, oh, good, baby's fine, and we're good. But Jennifer, you also wanted to know what to do when you get your baby, or babies, home. So we're going to talk about a few things to watch for. You mentioned jaundice. And jaundice is a very normal process that happens to newborns. They're kind of basically born with a little more blood than they need, so that blood starts to break down and releases a yellow pigment. And it starts usually in the face. It's normal for the baby's face, maybe the eyes to be a little yellow. You don't really need to worry about that. But once the jaundice starts to move down into the chest or the belly, that means the bilirubin level is a little higher. It's probably time to call your pediatrician on that. The next thing to look for is the belly button. You just want to kind of keep it clean with water. Don't put anything on there, like no more alcohol or anything. But what you want to watch is for pus. We don't want to see any green, oozy pus around the belly button. Next, an interesting sign that's kind of alarming, but it's really no big deal, is an orange powdery substance in the diaper. It's actually caused by a normal transient crystal in the urine, and it creates this kind of, it looks like somebody wiped orange lipstick in the diaper, and it may happen a couple of times. It's perfectly normal. And then the last thing, you want to get to know your baby's soft spot. You just want to feel it and just kind of know what the normal feels like, so that if it changes, if it becomes sunken, that might be a sign of dehydration. Or if it becomes bulging out, that might be a sign of an infection. Both of those, time to call the pediatrician too. So just get to know what the normal soft spot feels like.
Good stuff. Thanks, Dr. Shears.